See the belief they have, like he is almost unable to move, but still he has taken a journey, he has come to see us just in the hope that I can make him a little bit better. So it's also inspiring. We come to the next patient, 865, follow up. I can report to that one. He has come to us with a vocal cord nodule with hoarseness of the voice, which has been there since last 6 months. I first saw him in July last year. Gradually voice has been deteriorating. The hoarseness is worse when he wakes up in the morning. It gets better as he continues speaking as the day progresses. There's a lot of heaviness in the head. Worse from continued talking. Stool is about 5 to 6 times in a day with some mucus. There's a reddish patch on the left cheek. It's more like a hemangioma. If you see the left side of the face, it's more like an hemangioma, left side of the face. No pain or no symptoms due to that. He is sociable, organized, doesn't like too much people. এটা কি দিচ্ছ? পেশেন্ট আসেনি তো? এটা ক্লিনিক ভিজিট নেই, মানুষ ওকে জিজ্ঞেস করে এগুলো। He doesn't like social gatherings, doesn't like to go out to meet people, social gatherings. He likes spending time alone. Sorry, no, he doesn't like spending time alone. He likes spending time alone. Sorry. He likes spending time alone. He likes salty and sweet. Earlier he used to have epistaxis, which is not there now. He used to smoke quite a lot, but since having been diagnosed with the vocal cord polyp, there's a polyp in the vocal cord nodule. Since been diagnosed with that, he has stopped smoking. I'll pass on the report. It shows a right vocal cord nodule, growth. Miasm, vocal cord nodule, psychosis, growth, right? Hoarseness. I want you to take this in your clinical tips, please. Few interesting organopathics for hoarseness. One of the medicines which you have had really good results with, and I have shared this with you probably, Populus canadensis. I want you to have a look in Boricae for this medicine, Populus canadensis. Especially when there is a cold and the hoarseness is resulting from the cold, Populus really works well. Populus canadensis. Are you there, Populus canadensis? Hoarseness from a cold. You see, there is a line in Populus can, instantaneous voice producer. If you see in Populus can, it mentions instantaneous voice producer. That works really well for Populus canadensis. Especially you have a cold and you got hoarseness from that, you can use Populus canadensis with very quick results. That is what you need for hoarseness. You're with me? Populus canadensis. You can use that in tincture, you can use that 6C as well for Populus can.
Is that one you consider for singers or?
Yes, we do. Especially it's from a cold. Yeah. It is due to a cold. Had something cold drinks and hoarseness as a consequence of that, it works miraculously fast. Second one which we use quite often, everyone got Populus can? Second one, which we use quite often as well, which you can have a look in Boricae, please, is borax. I want you to open borax and look in the dose section, please. If you see in the dose section in borax, I'll just read it out. A piece of borax the size of a pea acts magically in restoring the voice in cases of sudden hoarseness brought on from cold. Are you there? Dose section, borax. Dose. Dose section at the end. A piece of borax the size of a pea acts magically in restoring the voice in cases of sudden hoarseness brought on from cold. Especially if you have a history of recurrent mouth ulcers and the patient has hoarseness with that, borax can really work well as an acute as well. You see, it's mentioned, acts magically in restoring the voice in the dose section. We have tried borax with really, really good effects, and borax works well. No, not in that fashion, but like 6C, 30C, we try that and it works well. There it mentions about using crude borax, but no, we don't do that. But 6C, 30C of borax is wonderful. Again, as an acute, I'm talking about acute hoarseness, right? And the third one, which you can try with good results in hoarseness, is ammoniacum causticum. Ammon caust. You know, causticum is a medicine which has got a good affinity for hoarseness, right? Now I want you to have a look in ammon caust. A-M-M-O-N, ammon caust. So Populus canadensis, if you have hoarseness from cold, you had something cold, you went out into the exposed to draft of cold air, you got hoarseness, that is Populus can. Borax is hoarseness if you have a past history of recurrent mouth ulcers. Whereas if you see ammon causticum, ammon caust, in ammon caust you can prescribe this for acute hoarseness with lot of rawness and soreness in the throat. If you see the respiratory section mentions about burning and rawness. You get that burning, you get that rawness in case of causticum as well. But ammon caust works really well for sometimes an acute hoarseness in a causticum constitution. It's an acute medicine which you can use for acute hoarseness, especially with the rawness and soreness which you expect with causticum. You with me? Ammon caust works well with 30C and 200C. Ammoniacum group works well for the heart as well. So in that way, I think it's mentioned about the cardiac stimulant as well. You with me? These are your three for acute hoarseness. Please incorporate these in your clinical tips. Coming back to this case. What is the modality for the hoarseness? Worse when he starts talking. It clears up as he continues talking. I don't know if you have used this medicine for hoarseness, but we started this case with Rustox. Rustox is a fantastic medicine for hoarseness if you have this modality. You know Rustox has got aggravation first motion better by continued motion. Apply that in the same way with hoarseness. Aggravation first talking, better by continued talking. Rustox is right-sided. You saw the vocal cord polyp, right-sided. Vocal cord growth is right-sided. With the psychotic miasm as well. So put a note here, the plan is Rustox, we'll follow it up later on with causticum. But we started off with Rustox 30C, considering the hoarseness, aggravation first talking, better by continued talking, and the right-sided affection for Rustox. Started in July with Rustox 30C. September we had boosted. October 30C again. December we went up to 200C, and that was the last prescription. কম ছিল তো এখন কি একই রকম লাগছে মাঝে কমেছিল তো He says it was better, but again with the return of the cold, the hoarseness is there now. এখন হচ্ছে আর কিছু I'm repeating Rustox 200C again today, and I'm putting a note, if required I'll give him Populus can in tincture if there is a lot of increase of the hoarseness. But I'm repeating Rustox 200C today. Make sure with hoarseness, if there is improvement, go up to at least 1 m of Rustox, and then you can think of changing the remedy. Ammon cost is more for an acute. This has been going on for a long time, so causticum will work. Sometimes what happens, there are phases of acute hoarseness in a costitum constitution. In those cases, you can prescribe ammon cost to take care of the acute cold, because causticum won't work so quickly. Especially, you think of singers and public speakers, like you have given them causticum, they're improving, but there is suddenly an attack of hoarseness and they have a meeting tomorrow. So in those cases, ammon cost can help you to overcome this acute phase of hoarseness, when causticum will take some time to work. We're giving 200C again today.